guys, Kieran here, Flex Physiotherapy. So super excited about how our open evening went yesterday. That was a massive success. We were quite taken aback actually. Myself and Matt were run off our feet for about 3 hours doing various mini assessments and giving out advice, so it was really great. So just wanted to do a really quick video today about osteoarthritis. So it's obviously a very, very common condition. Everybody knows somebody who's got a degree of osteoarthritis. You've got hip replacements, knee replacements, and all that jazz. Now, the reason I wanted to do this video is because our thinking around osteoarthritis has changed a bit. So we used to think that osteoarthritis was a wear and tear condition, that basically the joint surfaces are wearing out. Now, to some extent that's true. So we know, for example, that if you take sections of meniscus or cartilage material out of a knee, that you increase the pressure going through the joint surfaces, and that will accelerate osteoarthritis. So that there clearly is a kind of a mechanical component to this condition. But some evidence suggests that actually if you exercise and if you run, for example, you may actually protect your knees from osteoarthritis. So kind of what's going on here? Well, we know that if as you get heavier, so if you increase in weight, we know that that will increase the incidence of osteoarthritis of the knee. But we also know that as you increase in weight, the incidence of osteoarthritis of the hand also increases. So that doesn't really kind of make sense, because you haven't actually got that much weight going through your hands, clearly, but you develop osteoarthritis as we become more overweight. Now what we're starting to discover is that osteoarthritis is at least in part a metabolic disease. So what that means is that it's a disease that may at least have some similarities with being overweight, with being hypertensive, so having increased blood pressure, with being diabetic. And these things seem to increase the risk associated with osteoarthritis, getting osteoarthritis. So, for example, one of the thinkings around this is that fat cells release inflammatory chemicals called adipokines, and these adipokines are thought to have a negative effect on articular cartilage, so can actually kind of hasten the development of osteoarthritis. So that's quite interesting. So when you look at an X-ray, what we typically see with an X-ray is that the joint surfaces start to become worn, and you start to get a reduced joint space as the articular cartilage starts to wear. And we also see that underneath the surface of the bone you get what's called a sclerosis, which is like a thickening of the bone. So what we used to think happened was the articular cartilage wears, you get increased pressure through the subchondral bone, the bone underneath, and then you start to get some thickening of the bone in response to that. But what may be happening is that if you've got some kind of metabolic risk factors, and you're perhaps pre-diabetic, or you've got hypertension, could be that you've got small blood vessel disease in the surface of the bone, and that causes the sclerosis. And if you've got sclerosis there, perhaps the nutrients is not getting to the articular cartilage, and that's what causes it to wear. So I suppose the reason for making this video is just to explain that perhaps osteoarthritis is not as straightforward as we used to think it was, and maybe it's not simply a wear and tear condition, but maybe, just looking after our general health, keeping our weight under control, keeping our blood sugars under control, keeping our blood pressure under control, all of those things, perhaps, you know, those things might be a good idea to protect us from osteoarthritis, as well as other medical problems. So I guess it comes down to you know, good old-fashioned advice. Watch what you eat, keep yourself fit, keep yourself active, and ultimately that'll be good for your joints. So I hope that's been a little bit helpful. Just some thoughts really, and I'll speak to you again soon.